ناوه خودی و پیغمبرا تشکر خودی خود کمو تشکر به دکتر رامی کمو که از خستخانه ماکس هات میره و بری 3 ماه او 3 جار از من عملیات که جاری که من شکر هبو شکر من چون سری به جارش جارا دوی درمان دانم وقتی درمان دانم من شما با کردستان عراق دبر بارزان
بو نخوشی باب خو مشکلات اجنوی هبوه هاتینه سردان نخوشخانه ماکس مکردیه لنیو دلهی خستخانه که پیشکفتی ماکس.
We had to then sit down with family, discuss with them why managing his diabetes and controlling his blood sugar levels are so important for doing a replacement. Patients with diabetes need to control their blood sugar levels. They need to improve their diet and then of course manage with exercises and other issues.
بابا من دست به که نتیجه بخوب بچیتن مشکلات چوکه و هبو اجنوی تقریبا مواد 3 هیوا کتسجی منشیان چه 4 سر بوه بینین 3 گورینا اجنوی و لان دکتر رامینی که تازه شیتن بخوب چیتن ریو چیتن ما دست خوشی بود که دست خوشی بو.
So he got his revision knee replacement done. It was done in 2 stages. In the first stage, he was managed with control of diabetes. Implant was taken out and after thorough wash, an antibiotic spacer was put into his knee. After 6 weeks, he was absolutely infection free. We waited for another 6 weeks, got all his required investigations and tests, and there was no infection. Sugar was under control. HbA1c had come down to less than 6. Her blood sugar levels were around 90s. So he went in for his stage 2. Around 1 week, 10 days after his surgery today, standing with me, walking, absolutely pain-free, ready to fly back to his country.
زور ممنونم که دکتر خستخانه ماکس زور سپاس دکتر رامی که زور دست خوش لوان و لجماعتی وان کن الحمدلله زوری باشم شکر صد من اینا شکر به خدا پلاتی من زوری باشه الحمدلله.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.